Number 3, can personal devices improve your health?
For most of our waking hours, we sport smartwatches strapped to our wrists or smartphones tucked into our pockets. We rely on these mini computers for an ever-expanding array of tasks. But can these digital companions make us healthier? Can they warn of an impending heart attack or predict the early stages of Alzheimer's disease? That's precisely the goal of a new wave of research that seeks to harness the vast amounts of data that are collected passively throughout the day by personal devices, such as Fitbits, Apple Watches, and smartphones. For example, how often does an individual stand up and move around? How far does she typically walk, and for how long? What is her gait like? How often does she leave the house or make phone calls? How frequently does she send text messages? How fast does she type? To sort through the big data that flow from these devices, researchers are turning to different forms of artificial intelligence to create a kind of digital phenotype that could help monitor patients' health over time. For example, a team in Boston is leveraging this approach to study patients who have recently undergone treatment for brain cancer. In many forms of the disease, the standard of care post-treatment is fairly straightforward. Patients receive an MRI scan every few months to check for complications or reoccurrence. The Boston researchers are now looking for ways to stratify these patients, using digital phenotyping, for example, to help pinpoint those who require more aggressive interventions. They and others believe that data from smartphones and other personal devices will soon become another tool in clinicians' toolbox to help identify acute changes in patient behavior that indicate a decline in health.
And representing this topic is Omar Arnaut. And obviously,